Yeah, AI, it's an exciting idea, and there's going to be people that are going to be supportive and people that are going to be afraid of it. Just like the steam engine, however many years ago that was developed, there's this idea of man versus machine, but we need to embrace man or woman with machine. Because AI is coming, it's going to be utilized in the House of Medicine broadly, because very smart people, tech people, see an opportunity to make money in our space. So we need to own our space. We're dermatologists, we're derm NPs, we're derm PAs, and this is our space. And if we don't leverage this technology, someone else is going to come in and try to do that. So what the promise of AI is to enable us to do our job better in a faster way and deliver more accurate, timely care. Some of the pitfalls, if derms aren't involved in navigating that care and helping frame the conversation, are going to be patients that are going to be falsely reassured. Susie Q is going to scan her melanoma on her iPhone app, and she's going to erroneously be told that maybe her amelanotic melanoma is nothing to worry about, and she's not going to seek the care that she needs, and it's going to lead to a delayed diagnosis. So we need to be stewards of this technology. We need to understand how it works. That way we can interpret it. The converse is also true. Maybe someone scans a lesion that's a seborrheic keratosis, and it's on their nasal tip. That's always the least favorite area to biopsy for most of us. And they come in and they're demanding a biopsy, or even, let's say, an excisional biopsy. Let's be as extreme as we can. No one would ever do that. But the AI said it's melanoma, and they see an unenlightened provider, someone new, maybe not even a dermatologist, a GP in their small town, and that person gets a big thwack off the tip of their nose. So there's the potential to do harm with technology that has enhanced sensitivity, and there's also, by doing unnecessary treatments, there's the potential to do harm in technology that has too low of a sensitivity, because we're going to miss certain lesions. And the same is true when we use AI to guide histopathologic diagnosis. So we're seeing more and more of that. Scan an H&E slide and have AI render a diagnosis. Here's the trouble with that. For difficult to diagnose melanocytic lesions, 2 out of 3 derm paths can't agree. You know, that severely atypical nevus might be a melanoma if I spilled my coffee, slamming my brakes on to get through the red light. I don't do derm paths, so that would never happen to me. But these are the stories that my derm path friends tell me. There's actually been numerous studies that have demonstrated you can give the same slides to the same dermatopathologist a year apart, and their diagnostic concordance is surprisingly disparate. So what happens when you use expert consensus to train an algorithm that this is melanoma and this is a banal nevus? Well, when the sensitivity and specificity of these expert consensus ranges from 60 to 80%, how do you think your machine algorithm is going to perform? Even if the machine algorithm is just as effective as that board-certified dermatopathologist, a 60 to 80% sensitivity without a human factor overlooking it is going to lead to misdiagnoses. And then from a medical legal side, who's going to be held liable? Who's going to be sued? Is it going to be the AI company? Is it going to be the dermatologist that used an AI pathologist? Is it going to be the dermatopathologist who's overseeing a corporate lab where there's thousands of AI rendered diagnoses every day? What will be the checks and balances in the system to make sure that the AI is rendering the correct diagnosis? So we have a lot of work to do in this space, and it's going to be our burden to make sure that this technology is deployed safely and effectively for our patients.